Hi, my name is Katie and I'm a registered nurse at McLane Children's Medical Center, Baylor, Scott & White. We know that it can be stressful when your child has surgery, even when it's just a small procedure. This video will help you know what to expect the day before and the day of surgery or sedated procedure, so you will be more informed, be better prepared for the day, and be able to answer your child's questions. It is very important that you and your child follow the instructions you were given about eating and drinking on the day before surgery. Your child cannot have any solid foods, gum, or hard candy after midnight on the night before surgery. Until 6 hours before surgery, your child can have milk or formula. Clear liquids such as water, apple juice, Pedialyte, or Gatorade can be given until 2 hours before you report for surgery. Your child should take prescribed medications as normal unless otherwise told by your physicians. If these instructions are not followed, your child's surgery may be delayed or even canceled. Please call your surgeon's office if you have any questions about eating or drinking the day before surgery. You'll want to gather all of the things you and your child will need on the day of surgery, like your child's insurance card, list of all medications your child is taking. This includes medications prescribed by a doctor and over-the-counter medications like vitamins as well. Your child can also bring comfort items like a special blanket, pillow, stuffed animal, or handheld toy. If your child still uses a bottle or sippy cup, please bring an empty one he or she prefers to use for when they wake up after surgery. When your child's surgery was scheduled, you received paperwork at the surgeon's office. This paperwork has detailed instructions and phone numbers for the day surgery department. You will receive a phone call 1 business day prior to your child's surgery date to complete a pre-anesthesia medical review. Please set aside 30 minutes for this phone call with a day surgery nurse. It is during this phone call that you will be given the arrival time for your child's surgery, along with the address of McLane Children's Medical Center. Please call 254-935-4211 if you are not sure where to go on the day of surgery. The surgery report time you were given during your pre-anesthesia phone call is the time you should arrive for admissions. Please plan for plenty of travel time in traffic. On the day of your child's surgery, you may park in the parking lot next to the playground area in front of the hospital and clinic. Once you enter the hospital, please check in at the front desk with a valid driver's license or picture ID. Medical information is sometimes difficult to understand. If English is not your primary language, you can ask for an interpreter in the language you are most familiar with at any time during this process. After admissions, you and your child will be escorted to the pre-op waiting area. Staff will come to pick you up from this waiting area and take you to your pre-op room in the day surgery unit. From this point forward in the preoperative process, many people will talk to you and your child and ask many questions. Hospital staff will ask your name and your child's name and about the type and location of the surgery your child will be having. They will ask about when your child last had anything to eat or drink and about any allergies your child might have. Many people such as nurses, anesthesiologists, and surgeons will ask these same questions. This is double and triple checking facts, making sure your child's surgery is as safe as possible. Nurses will also confirm that you have signed all of the consent forms for the surgery at this time. Your pre-op nurse should go over the plan for the day and answer any questions you may have. If your child is anxious or nervous about being in the hospital, we have child life specialists who can help your child feel more comfortable about being here. Next, you and your child will meet with an anesthesiologist. This doctor will give the medication that makes your child stay asleep during surgery. The anesthesiologist will ask questions regarding family history, your child's health history, and any history of previous surgeries. Next, your child's surgeon will visit to discuss the surgery. The surgeon may also mark the part of the body to be operated on. This is just another way to put your child's safety first. Once all of the pre-op activities have taken place, your child will be taken to the operating room, and in some cases they will be able to ride one of our plasma cars. You may accompany them to the operating room doors, or the hugs and kisses line as we like to call it. Parents of children having short day surgery procedures will then return to their child's pre-op room. Those with children having longer procedures or being admitted after their surgery will be directed to the surgery waiting room. While your child is in surgery, it is important to tell the staff if you plan on leaving the immediate area. We do ask that at least one parent stay on the hospital premises at all times while your child is in surgery and recovery. The surgeon and nursing staff will need to be able to contact you during and after surgery, so we will ask for a phone number that you can receive calls and/or text messages on. You will be sent several text messages or phone calls to keep you updated during your child's surgery. Please keep in mind that you will be at the hospital for several hours. It is good to bring reading material and other activities for you to keep busy while your child is being cared for. We do offer courtesy Wi-Fi, so electronic devices such as laptops and tablets are welcome. Even though brothers and sisters and family members want to be there with a child having surgery, we have found that it can be difficult to keep young children occupied for long periods of time in the waiting area. Many parents find it less stressful for themselves and for the child having surgery to plan other activities for siblings on that day. After surgery, the doctor will give you a report on your child. After your child wakes up, you may be taken to the recovery room to be with your child. Once your child has met certain criteria, they will be transferred back to the day surgery unit for the remainder of their recovery and to prepare for discharge. During this time, nurses will visit with you to give you detailed instructions for caring for your child after surgery. Once anesthesia has given the okay, you are ready to be discharged and travel home. If you have any questions about your child's recovery on the days following surgery, do not hesitate to call the phone number in your discharge forms. We hope this video will help you know what to expect on the day of your child's surgery. Our doctors, nurses, and staff at McLane Children's Hospital are always here to serve our patients and their families.